Now, a WBAL News Radio Town Hall special, The Coronavirus. Here with Brian Neiman is C4 on WBAL News Radio 1090, FM 101.5, and the WBAL mobile app.
You know, Brian, we've been very pleased to now bring a fourth WBAL News Radio virtual town hall, the coronavirus, to the airways in our great partnership that we have with GBMC Healthcare. Joining us this morning will be Dr. Theodore Bailey, the Chief of Division of Infectious Diseases, GBMC Healthcare, Dr. John Chessar, President and CEO of GBMC Healthcare, Dr. Timothy Doran, Chairman, Department of Pediatrics at GBMC Healthcare, and Dr. Anthony Chico, the Medical Director of Emergency Psychiatry at GBMC Healthcare. And it's really a lot of things happening, Brian, right now in the COVID-19 fight that we need to address.
A lot of things to get to, so let's get at it, C4.
Let's go right to it. Let's ask first of all, good morning, Dr. Theodore Bailey.
Good morning.
Let me ask you, Dr. Bailey, breaking news is the fact that Dr. Anthony Fauci, we all know about mask wearing, though, but now he's talking about goggles and eye shields as a part of our PPE, so to speak. What are your thoughts as we are now kind of evolving in this fight on COVID-19?
Well, what we're seeing is, certainly not the kind of returns that we need. We're still in the middle of it. I was hoping we wouldn't need to have this fourth town hall, but we are. And so I think that's a responsible approach to start to ask, well, is there more that we can do than what we've been doing? But I will point out that most countries in the world have flattened their curves, gotten things down under much better control than what we have, and they've done it without the general use of goggles. So, but the point is that we as a nation are not having that level of success, and so we may need to do things that other countries have not, because perhaps we're not doing other things as well as other countries are.
On the mask front, though, and I've noticed this myself, and a lot of people are using the cloth masks, and you take it off, you don't know where to put it, you hang it in from your rearview mirror, you put it in your pocket, you put it down on your keyboard. Are you concerned about that aspect of it? And the cloth masks, especially, some of them are very thin. Is there a false sense of security that people get with these masks, especially if they're not wearing them correctly?
I don't think so. I mean, there can be a false sense of security in the sense of I just have a mask, right? It is about using it correctly, and that's true for all safety equipment, whether it's seat belts or anything else. Just putting a seatbelt on the wrong way is not going to help protect you in a car accident any more than using a mask in the wrong way. But we haven't seen some sort of very specific difference between the masks that we have and, say, the masks that are used in other countries. And so we do see success in other countries, with a variety of mask forms. So that, I don't think it's such a precise technological issue as it might seem at first. It is really about the consistency of use, because masks will reduce the risk of exposure. And the idea is that the more you wear it, the more you can reduce your risk. And the less you go into situations where you might even need to wear a mask, that's even further risk reduction.
We're pleased to have on board Dr. Theodore Bailey, the Chief of Division of Infectious Diseases at GBMC Healthcare. It is the Coronavirus Town Hall Special with GBMC. And Dr. Bailey, we had the Surgeon General of the United States on yesterday, Dr. Jerome Adams, and he and some others feel very confident about us getting to a vaccine, hopefully before the end of the year. What are your thoughts about that, and what are you hearing?
Well, they're in phase 3, and that's kind of the large upscaling trial. And you don't get to phase 3 unless you're seeing some promising data in terms of the earlier phases of the trial. So it's certainly a possibility, but I have to say it's only a possibility until it's a reality. There are lots of other viruses that we would love to have vaccines for, say HIV, for instance, for which we've been trying for decades. So until we can really see that play out, we just have to keep our fingers crossed, but not just keep our fingers crossed, but really press for ongoing active research in this area on multiple fronts. So it is something that we can make things go faster and still meet basic scientific criteria as long as there's political and public will to do so. So that research really should carry on.
One of the biggest debates right now, obviously, is the schools. What do we do with kids? Can we put them in the school buildings? Can we do it in a hybrid, or does it have to be e-learning? There's a lot of pushback, especially from the teachers who don't feel safe. We completely understand that. But from your point of view, from an infectious disease doctor, what exactly should we be looking at? Like, is there a data point? Is there a metric? Is there a certain protocol that you have in mind to say it is safe for kids and teachers to be in the building?
Well, when we're talking about schools, we're not talking about a one-time only event. We're talking about you go on Monday, you go on Tuesday, you go all week, you go next week, and you go next month. And one of the concerning features is that we have large amounts of data on single event outbreaks that, say, a family gets together, a large amount of family get together, or a church gets together, or, say, a Florida baseball team gets together. And, bam, multiple infections really within a very limited amount of contact. And a school would be that on steroids. A school would be that, large aggregation day after day after day after day, week after week. And so really right now it looks like it would be a high-risk situation. And, if there's still active transmission in the community, active school contact would be an amplifier for that, would really be expected to set that back up again.
Even with kids, and the fact that you were just talking about Europe and how Europe is being able to do things with masks that we haven't been able. Well, they've been putting kids in school in Europe. So what about those two things?
So they've been able to do it because their background rate of transmission is quite a bit lower than ours. They've had that success that then sort of allows them to leverage that into schools. And also, the thing is, the fact that they've had success suggests that they're doing other things much, much better than what we are. And that may translate to what they can communicate to their children in terms of compliance with masks and such. Our failure at this would really lead me to suspect that if we can't do it well in the community, I don't know why we'd be able to do it well in schools. If we can't communicate to adults who can process this well, I don't know how we could communicate it well to children.
Well, what about the transmission of the kids and that factor?
Yeah, that is a factor. So although if you take one child and one adult, that child, especially with COVID, is less likely to transmit it, that can easily be offset by just multiplying the number of kids. And, you're talking about potentially maybe half as likely, maybe a fourth as likely. So one child might equal, it might take 4 children to equal one adult in terms of the ability to transmit the virus. But we're talking about schools, so that's already a problem because you've already multiplied the number of people you're talking about. So the fact that a one-on-one comparison definitely favors adults as transmitters. The schools as a place where you're going to have multiple children, you would lose that advantage. You would have multiple children there and therefore a relatively high risk of transmission.
Dr. Theodore Bailey, you mentioned the Florida baseball team, and since I'm a big Baltimore Orioles fan and the Miami Marlins had to cancel their games with us, how difficult is it right now, we watch the outbreak with the Miami Marlins, for MLB players to avoid exposure to this?
Well, it's a canary in the coal mine in a sense. I think it should be a wake-up call to the other teams in terms of looking at what they're doing. They certainly haven't set in place anything like what the NBA has, where, there's a real isolation of the entire sport league, and I'm not sure where the line is between what the NBA is doing and what the MLB is doing in terms of what would get them to that level of safety. And we still have to see how well that bubble works in Florida. So that's just something that we're going to have to see what they try and what works.
We're talking with Dr. Theodore Bailey, who is the Chief of Infectious Diseases at GBMC. What about asymptomatic people? Do we know yet? Can they pass it on still? I know about being pre-symptomatic, but what about asymptomatic? What more do we know about that?
Well, it's the presence of the virus in the airway that's the condition for being able to transmit it. And the folks who are asymptomatic, in a number of cases, we are able to identify virus in the airway, which is really all that needs to be true for it to be transmissible. I think one of the things that we have learned, though, is that people who've had infection and gone far out from it and are not symptomatic, but maybe still detectable on a test, what we're detecting in those people seems not to be transmissible. It seems to be fragments of the virus itself, and that has led the CDC to amend its recommendations for isolation so that if a person's 10 days out from either their first test or from their first symptoms, they shouldn't be transmissible even if their testing comes back positive. And that's led to kind of a time-based recommendations. It used to be test-based. So you couldn't come out of isolation unless your tests were negative. Mm-hmm. But we've realized that time is the more important factor for that. So those people who are asymptomatic perhaps and still detectable on their test are unlikely to transmit it. But people who have perhaps just recently been infected will still have viable, transmissible, contagious virus in their airways whether or not they have symptoms.
Finally, Dr. Bailey, I want to ask you about flu vaccines. We talked about this before, but how important, particularly, is this season going to be in terms of people getting their flu vaccine?
I would say more important than ever before. Not because the flu vaccine will provide any protection against the coronavirus, but the problem will be that to survive 2020, you have to not get severe flu or get severe corona. And right now, there's limited things we can do about corona, so we should do as much as we can do about all the other things that we can control. One of them is our vulnerability to flu.
Very good. Dr. Bailey, good to have you on. Thanks for coming on the show. We appreciate it.